Everyone, my name is Danielle Nierenberg and I'm president of Food Tank. I'm incredibly excited to welcome you to Food Tank's monthly webinar series. Over the last several months, we've had webinars on food waste, urban foraging, sustainable seafood, perennial crops, and indigenous foods. And today I'm incredibly thrilled to have Dr. Charles Benbrook with us to talk about the health benefits of organic foods. Dr. Benbrook is a professor at Washington State University's Center for Sustaining Agriculture and Natural Resources, and recently co-authored a study comparing organic and conventional crops. The study found that organic foods have higher levels of antioxidants and lower levels of pesticides than conventional crops. And in addition to his incredible work at Washington State, Dr. Benbrook has worked for the Executive Office of the President, the U.S. House of Representatives, the National Academy, and is chief scientist at the Organic Center. Dr. Benbrook is also a longtime friend of Food Tank and a member of our advisory board, and I'm incredibly grateful for all of his hard work and his support and encouragement. Today's webinar will be recorded, and you can follow tweets about the webinar at #FoodTankLive. Dr. Benbrook will talk for about 45 minutes, and we'll hopefully have around 10 or 15 minutes for questions after the presentation. So Dr. Benbrook, over to you. Thank you again.
Thank you very much, Danielle, and I'll try to leave a bit more time for questions because that's always when things get interesting. And thanks so much for the opportunity to reach the Food Tank audience. It's a very important one. I was privileged to be part of a large international team put together by this gentleman, Carlo Leffert, who is a professor at the University of Newcastle in the UK. We worked for about a 3-year period to carry out the most detailed and rigorous meta-analysis of the peer-reviewed literature around the world on the nutritional differences and food safety differences in organic and conventional foods. This meta-analysis focuses solely on plant-based foods, so fruits, vegetables, grains, nuts. And mostly the same team has a second meta-analysis coming out in the British Journal of Nutrition, probably in December, that focuses on meat, mostly beef, pork, and poultry. And a third meta-analysis will be published in the British Journal of Nutrition in March or April on milk and dairy products. And we're very proud of this set of state-of-the-art meta-analyses because not only have we tapped into the much larger contemporary database of studies looking at nutritional differences between organic and conventional food, we've also used more sophisticated and recommended meta-analysis techniques to carry out our study. This is the landing page for the study on the Measure to Manage website. That's Measure Manage is my program at WSU. The abstract appears, and then in this box here are a whole set of resources and further information about the study, all of this material has been developed for lay audiences, and I invite anyone after the webinar to explore this material in greater depth, and please share it with your colleagues. We have the press release from WSU as well as Newcastle. This link takes you directly to the full paper. It's an open access journal. You don't have to pay. The full paper and the supplemental data, which is 82 pages of detailed results. This is a blog that I did and released the day of the study. This is a very helpful section here. It presents a series of typically asked questions or frequently asked questions about the study, the major findings, and how do you measure nutritional quality. Why are antioxidants important? And this question, are the nutritional differences between organic and conventional crops meaningful in terms of altered health outcomes? a critical question that's been central to the debate. This section it's fairly lengthy because it covers every substantive aspect of the study, but it presents things in a very easy to understand way. I'd like to just quickly summarize the phenomenal response we got in the media to this study. As Daniel knows, I've been doing this sort of analysis and releasing reports for almost 40 years now, and including a few fairly significant ones from organizations like the National Academy of Sciences. And in my whole career, I'd say this study got in the top 3 in terms of the global media. There was a large team working in the UK on the European media, and I was asked on behalf of the team to work with the US media. We did a media tour of New York City and Washington, D.C., and just hit everything right. The total reach of stories on this study, and it's a very technical study, you wouldn't think there would be widespread interest in the media, but we're at almost at 600 million in the total reach of the newspapers, magazines, TV stations, and radio stations that have covered the story. And that, for those of you that don't follow how one measures the effectiveness of a release campaign, 600 million total in total reach is a phenomenal number that only a few studies a year in any given area will reach. This is the section of the website where the major findings are laid out in as clear a way as possible. We spent an enormous amount of time on this to make this section of tables look good on the web, but you'll also note you can download this whole section as a PDF, or you can print it, or you can download the PowerPoint with all the text as notes, or a zip file that has all the figures in another format. So this is our attempt to make this information available to people in as many forms and ways as possible. So in terms of the 343 studies, the reason our analysis reaches substantially different conclusions than some of the earlier analyses is really all about from 2008 on. None of the sort of high-impact earlier meta-analyses included studies from 2009, 2010, and 2011. And some of them also only included a few months of studies in 2008. So basically, these bars represent new studies incorporated in our meta-analysis that were not incorporated in earlier ones. This is obviously it's significant because it almost doubles the number of studies to draw upon, which of course increases the statistical power of the analysis. But more importantly, as scientists carried out comparison studies over this era, there was a lot of discussion in the journal about the appropriate methods to use, the most robust experimental designs, the best ways to carry out the statistical analysis, how to draw upon some of the complex aspects of advanced meta-analysis to come up with the most reliable results. And so the science got better and better and better, and by 2008, 2009, most of the published papers are actually much stronger and much clearer in terms of their comparisons between an organic farming system producing apples, for example, and a conventional farming system producing apples with the same variety in the same region, same irrigation, obviously the same weather. And so when people ask you or wonder why our findings differ so much from some of the earlier studies, this is really why, these newer and better studies that have come forward. The the breakdown of the 343 studies in terms of what they focused on pretty heavily weighted to vegetables, as you can see, with vegetable and fruits accounting for well over 2/3 of them. Uh, uh, this is very clear in the literature. Um, in terms of where the studies came from, as you might expect, the largest number has come from the U.S., but it's really quite interesting to see, for example, that Poland has done more studies than the U.K. And another number of other large European countries. Both Spain and Italy high up there, and there's great interest in organic citrus production and olives and nuts and horticultural crops in Spain, because farmers in Spain are so dependent on access to the high-value markets throughout the EU. So there's a lot of great work being done on organic production systems and research on organic in Spain. And much the same can be said of Italy. We all know how seriously Italians take their food, and you don't have to work too hard to find an Italian on the street or at a cafe that would agree with the statement that organic food tastes better generally and it's better for you. So this is clearly reflected in the number of studies. But watch out for Brazil. Quite a few studies being done there, and despite Brazil's embrace of GE soybeans and corn, there's a very healthy non-GM and organic sector emerging in Brazil, with their eyes very much on the European market. So in this meta-analysis, we looked at all of the significant and important different categories of nutrients that support healthy human development and healthy growth. These are the categories of antioxidant compounds that likely are why fruits and vegetables are such a critical component of the diet in terms of promoting health. As some of you on the webinar know, who are familiar with the epidemiological literature on dietary patterns and fruits and vegetable intakes and results in terms of health trajectories and various health problems and diseases, no one understands exactly what it is in fruits and vegetables that confers this almost magic ability to promote health. But most scientists believe that measures of total antioxidant activity or total phenolic compounds come closest to being a reliable general indicator of the magic stuff in fruits and vegetables. Clearly, we know none of these measures picks up everything that's important, and nor has science even documented all of the health-promoting compounds in fruits and vegetables. But to the extent that we have some accepted indicators, it's the 3 or 4 different ways that total antioxidant activity is measured in foods, as well as total phenolic compounds. And so across all the studies, total antioxidant activity was 17% higher in the organic foods compared to the matching conventionally grown foods. And then in terms of phenolic compounds, 25, almost 26% in the flavones and flavonols, a very important subset of antioxidants, all the way up to almost 49%. So these are significant findings, and even 5.9% higher levels of ascorbic acid, of course, precursor for vitamin C. We regard that as a significant finding. Most people around the world don't get enough vitamin C on a daily basis from their food, and even a 6% increase is a meaningful amount. There were two other major findings in the study that we focused on a lot in the press release and all the media work. One is that, and this was a total surprise to the team, we didn't expect to see this. We also didn't expect that there would be enough studies to reach a firm conclusion, but cadmium levels are on average 48% lower in organic plant-based foods. Most of the studies are from vegetables and grains, but we still feel that this is a statistically robust finding, and it probably relates to the fact that some phosphorus fertilizers that are mined actually carry with them enough cadmium to gradually increase the levels of cadmium in soil. And cadmium is, essentially permanent. It lasts almost forever. All of us will carry until our deaths all of the cadmium to which we are exposed during our lives. We also included the studies that reported differences in the frequency of pesticide residues in conventional and organic food, and much like the earlier Stanford study and really any study that's looked at this, it's no great surprise, but pesticide residues are far less common in organic food compared to conventional food. So these are the paper it's very technical, and a lot of the discussion and the results are designed to help people understand the impact of different meta-analysis techniques and assumptions, as well as different methods for and decision rules for what studies get included and not included. The most important distinction between this meta-analysis and the earlier Stanford study and the Danger study, which came out in 2009 from the Food Standards Agency in the UK, is that we reported all of the results in both unweighted meta-analysis and weighted meta-analysis. All of the experts in meta-analysis statistical techniques favor and recommend conducting a weighted meta-analysis whenever possible and placing greater weight on the weighted analysis results. The primary difference between an unweighted meta-analysis and a weighted one boils down to this. In any given study, let's say you're looking at organic tomatoes versus conventional tomatoes, and you've got 8 different studies that look at total antioxidant capacity. So you have 8 sets of results, which will be the mean level of total antioxidants on average across the 8 studies in the organic tomatoes versus the mean level of total antioxidants in the conventional tomatoes in the 8 studies. An unweighted meta-analysis simply reports that simple difference in terms of the average in the organic versus the average in the conventional. But we know that the quality and the statistical power of those 8 studies may differ. One study might have only compared 2 fields, and hence the average values are an average of 2. And that study might have quite a bit of variability in the findings. So a scientist looking at that study and saying, very small sample size and a high degree of variability in your basic measure of, in this case, average antioxidant capacity, would say that's not a very reliable study to draw any conclusions from. Especially there might be another study where the scientists did 22 comparisons and had a much smaller standard deviation in the means, which tells a scientist that it was a much more rigorously controlled study. So a weighted meta-analysis incorporates into the statistical calculation the number of samples in studies as well as the standard deviation. And just put simply, it it places greater weight on the higher quality studies that have larger sample sizes and lower standard deviations. So you can see it makes a very significant difference in the measure of flavones and flavonols, with the difference between organic and conventional almost doubling from 24, almost 28% to 46%. Now, it's not always the case, as you can see with carotenoids, total carotenoids, using weighted meta-analyses, it actually reduces the average percentage difference from about 22 to 17%. So if you hear anyone saying, well, this team was very clever, they just rigged the analysis to get the biggest number, and that's what they reported, you might point them to this figure and show that actually the weighted number here went down, and it went down here. So, you know, if we were in the business of monkeying with the data, one would think we would do it a bit more consistently. This table shows some of the other results, and this time breaking it out by fruits and vegetables. Again, you can see the big difference in vegetables in the cadmium finding, and also you know, very significant differences in the flavones and flavonols in the vegetable group, you know, so it's very clear that the pattern of differences in nutrients between fruits and vegetables is in fact quite different, and you know, I think this is an important finding in that while we often group fruits and vegetables together when we talk about the impact of organic farming on food nutritional quality, and in fact there are some substantial differences. Now, many of you no doubt heard about the Smith-Spangler study that came out in the Annals of Internal Medicine in 2011. This was a team of physicians based at the Veterans Hospital connected to the Stanford University Medical School. The whole team were medical practitioners and clinicians that were often asked questions by their patients about, well, should I switch to organic food? Are there documented and significant health benefits from organic food? So they did a similar meta-analysis, although, as I pointed out in the earlier slide, in terms of the year the different studies came out, Smith-Spangler had about 170 fewer studies than we did to take into consideration. But in some of the compounds, the differences are not that huge in terms of this standardized mean difference is another output variable that comes out of the weighted meta-analyses, and again it shows that actually our meta-analysis shows a smaller advantage or increase in phenolic compounds than the Smith-Spangler. Again, small difference here, much bigger difference in terms of total. I'm not sure what that's a total of. Protein, as most studies show, protein levels go down in organic food, and again, we showed a larger decrease in protein than the Stanford study. But many people asked us as we presented our results how our findings differed from Smith-Spangler, and so we've put together these slides. There was also a significant and well-done meta-analysis published by Kirsten Brandt in 2011. It came out in the journal Critical Reviews of Plant Science. And what we did here, this is the Dangar Food Services Agency from the UK, the results from that 2009 meta-analysis. This is the Brandt meta-analysis in 2011, and this is our current one, the Newcastle one. So again, you can see the differences across these studies. Not a lot of disagreement between Newcastle and Brandt on total phenolics. bigger differences in terms of ascorbic acid. These are unweighted mean percentage differences. Not too big of a difference in terms of the flavonols, and in terms of nitrogen, and a much more significant difference here. So these are some tables that we developed to present these results, and what I'd like to spend about another 5 or 10 minutes on is explaining why our team believes organically grown food is relatively consistently producing food that has higher concentrations of these phenolic acids and antioxidants and some vitamins. In the literature, there are two primary explanations that are presented in most studies that try to explain these differences. One explanation arises from the fact that on organic farms, farmers are not able to draw upon the synthetic insecticides and fungicides that conventional farmers routinely apply to protect the plants from the injury and damage from insects and diseases that are triggered by various viral and bacterial pathogens. On an organic farm, the farmer has to pay great attention to selecting resistant varieties when they're available, and then must manage that farming system in a way that there's sufficient microbial diversity in the soils and in the above ground ecosystem to keep the populations of any potentially damaging insect from ballooning to the level where economic harm is done to the crop. But even the most well-managed pest management system on a sophisticated organic farm is going to have some level of pest pressure. But if it's not too extreme, the plants have the ability to respond to the attacks and the potential threat of the insects and the plant pathogens. And the plants protect themselves by triggering the production of a range of phenolic plant secondary metabolites that are in effect the plant's immune system response or defense response. It turns out that the chemicals that the plant makes to trigger these defense mechanisms are in fact the most critical and important and biologically significant antioxidants and phenolic acids that benefit human health. And it's kind of intriguing to think from an evolutionary point of view that mammals evolved to require and in fact respond favorably in terms of their health status to these plant secondary metabolites that are being produced when plants are under stress and under attack. It sort of makes a little bit of sense when you think about it. So that's the first explanation that's typically in the literature explaining the higher levels of vitamin C and these phenolic compounds in organically grown food compared to conventionally grown food. The second explanation really boils down to yield levels and the source of nitrogen in an organic farming system compared to a conventional farming system, and the levels of nitrogen that are accessible to the plant at different points in the production season. And just think of nitrogen is to plants what calories are to a mammal. When a plant is growing in a location with ample to excessive nitrogen, it's just going to grow as fast as its genetics will allow, and assuming that there's enough water to support plant growth. Plants don't have the ability to say, oh boy, you know, my roots are in an area with way too much nitrogen. I don't like it. I'm going to get up and move. The plants have to deal with the amount of nitrogen that's in the soil that their root systems are moving through and extracting nutrients from. And when there is ample to excessive nitrogen, plants use that to produce foliage and grow bigger fruit, and they convert the extra nitrogen into the simplest compounds for them to make, because they've got to do something with it or the nitrogen would become toxic to the plant. So if you've got a lettuce field, a carrot, a grape, a tomato that's got ample to excessive nitrogen, the plant is converting that nitrogen to some simple carbohydrate or starch. It's the easiest thing for the plant to make. And as a result, you get these very large apples that are of a size closer to a grapefruit. You get these strawberries that, I think bulbous is the best word for it. But when you see conventional fruits and vegetables that just look really big, you can count on the fact that those fruits and vegetables were grown in fields with a high level of readily available nitrogen. And the plant converted that nitrogen to sugars and starch mostly, and also often to a lot of moisture. So in those big, juicy, sweet apples that we can find in the supermarket, especially in the fall of the year, yes, they're so sweet and they're so juicy, but all that extra sugar, carbohydrate, and all that extra moisture has also diluted the concentration of the more valuable phenolic acids and antioxidants and vitamins that apple also produced. So this is an explanation of the classic quote-unquote dilution effect that was recognized by plant scientists and plant breeders in the early 80s, and was first memorialized, if you will, in a seminal paper in I think it's the Annals of Crop Science or something. It came out in 1983, and this paper in 1983 coined the term dilution effect and presented hundreds of studies involving many different crops that showed a near linear relationship between the level of nitrogen available in the soil, the yield of a crop, and the concentrations of key nutrients in the harvested crop. So we all know that nitrogen is a very expensive input for organic farmers. There is no cheap, readily available source of nitrogen for organic farmers, whereas there is with conventional farmers. It is very common in the United States for a conventionally managed crop, whether it's a horticultural crop or corn or cotton or wheat, to have 50% more nitrogen applied to it than the crop really needs. And it's rare for a crop to not have at least 25% more. And farmers do that because it's a way to ensure that, if it's a great production season, the rains come right when they're needed, the yield of the crop will not be truncated by not enough nitrogen. But unfortunately, in 8 years out of 10, that level of nitrogen will be well in excess of what the plant can use, and as a result, a lot of that nitrogen is lost either to the atmosphere, contributing to global warming, or leaches down into groundwater or into the surface water system and becomes a non-point source of pollution. So, the second reason that organically produced fruits, vegetables, and grains typically have higher levels of antioxidants and some vitamins is that they're grown in soils with much less nitrogen and sometimes not enough nitrogen to support maximum yields. But organic farmers rarely are triggering the dilution effect by overamping their systems, and this is a fundamentally important difference between organic farming and conventional farming, because the differences in the source of nitrogen and the level of nitrogen applied in organic systems versus conventional systems accounts for improved nutrient content in the organic food, improved flavor and organoleptic quality in the organic food on average. It contributes to much lower contribution to total greenhouse gas emissions from the farming system. It reduces the adverse impact of nutrient flows off farm fields into surface and groundwater, and it can even lower the cost of farmers. And in a drought year, an organically managed soil with higher levels of organic matter will significantly outperform the conventional soils, irregardless of the amount of nitrogen applied to them, because the organic soils are going to take in the available spring and early summer rains more efficiently and hold that water longer to support higher yields later in the season. So we're very pleased to have this out. It was a long process, and I'll just close by noting the a remarkable amount of work that this whole team did. It was a 3+ year study, and the cost of it was on the order of $425,000. So it was a very large effort. The entire data set that we put together in Access, Microsoft Access, has been posted on the University of Newcastle website, and you can you can gain access to it by clicking on the Newcastle press release, and right at the bottom somewhere there's the link to the database. This will take you to the database. You can download it, and if you feel you have a better idea about how to conduct a study of this nature, you can have at it with the benefit of this data set that it took us 3 years to put together. So we're quite confident that this piece of work is going to advance our understanding of how organic farming systems impact the nutritional quality of plant-based foods. Thanks for listening, and glad to discuss any questions you might have.
Wow, Dr. Benbrook, that was incredibly useful and informative, and I certainly learned a lot during it. We have a bunch of questions from our participants, so I'm going to jump right in with the first one. And this is from a professor in Zimbabwe. And he says his question is about the differences in residual pesticide contamination of different foods. The Environmental Working Group has published lists of the Dirty Dozen and the Clean 15 for the last several years. The Dirty Dozen are foods so heavily contaminated that it's always best to buy them from organically grown sources, whereas the Clean 15 are reported to be so minimally contaminated that it's okay to buy them from conventionally grown sources. My question is whether Dr. Benbrook's research found this distinction to be valid. Based on his research, does he think some foods should always be bought as organic, but that others are so minimally contaminated that it doesn't make much difference if one buys them organic or not?
Great question. I've spent much more time through a long career working on pesticide use and dietary residues and risk than any other topic. This is another, for those of you watching the screen, I've just switched to another part of the M2M website on the Washington State University computer. This is our analytical system for pesticide residues in food. It's based on the Pesticide Data Program results, which is the USDA's official annual pesticide residue testing program. It is regarded universally around the world as the highest quality pesticide residue data set in the world. We have taken an enormous amount of data from almost 20 years of PDP testing and put it into an Access database system, linked it up with the toxicity data and reference dose data from the Environmental Protection Agency, and created a simple indicator of dietary risk, which the DRI stands for the Dietary Risk Index. There's two forms of it. This one is based on mean residues, and this one is based on mean residues multiplied by the frequency in which a given pesticide appears in food. This is a methodologically complicated system and set of tables, but let me just point them out so people can go back to them. But you can pick the crop that you'd like to look at the data on. These are all the crops that the USDA has conducted pesticide residue testing in. You can pick whether you want all the samples combined, which would be imported foods and domestic foods thrown in the same pot. The U.S. samples, domestically grown, combined imports, so that would be, in the case of apples, imported apples from Canada, Chile, Peru, and any other country that the U.S. imported a significant amount of apples from. So you'll see that in the case of apples, there's imports by country data for Canada, Chile, New Zealand, and then unknown, which means they couldn't track where it came from. You can also pick the year. So these in this drop-down box, these are the years that USDA tested for pesticide residues in apples. This part of the website is where we compare the residues and risk in conventionally grown apples. Long list, look at all of them. 3,644, this is a percent, so this tells you how many different pesticides are showing up in apples. The basic comparison in terms of number of residues, which is heavily weighted in the EWG system, is right here. So there's 5.45 residues on average in conventional apples and 2.07 in organic apples. And many people say, what the heck is going on? Why are there 2 residues in organic apples? Well, we know exactly why. If you look at this table here, this is the shows the residues found in the 15 samples of organic apples that were tested in 2010. And as you can see, it's these 3, diphenylmine, pyrimethamine, and thiabendazole, that account for all of the residues except for 3. So 28 out of the 31 residues detected in apples are post-harvest fungicides used in conventional packing sheds that are not cleaned out, cannot be cleaned out thoroughly when the packing shed switches from running conventional fruit to organic fruit for, Monday morning or Wednesday afternoon or whatever schedule they use. This same finding holds true in many other of the fresh fruits and vegetables, and in terms of the pesticide residues that are being found in organic food, a very high percent of them are coming from these post-harvest fungicides. These are different pages, like I just demonstrated, with tons of information about what we know about pesticide residues in food and the differences between conventional food and organic food and domestically grown food and imported. And specifically to the question raised by the member of the webinar, I do believe that there still are some residues of conventional pesticides in the U.S. food supply that really are not acceptable relative to developmental risks during pregnancy and for children through infancy. In Africa and in the developed world, the situation with pesticide residues is far, far more serious. We know from limited sampling and colleagues that I visited with over the years that some food in the developing world, particularly fresh fruits and vegetables, can have really surprisingly high residues of of certain pesticides. So it is indeed a significant concern, and one that I'd like to down the road be able to do some more work on.
Thank you, Chuck. The next question comes from one of our participants, and they're asking, how can this study be used to influence policy and investment from the funding and donor communities and governments?
Well, I think in a few ways. You know, I've been working in this space for a long time, and I have at times been discouraged by how difficult it is to sort of move the dial in production systems. I am absolutely convinced that there are substantial nutritional quality and food safety benefits from organic farming, and I believe that those benefits are quantitatively significant enough to support substantial investments and changes in public policy to at least take away the bias against organic farming. That would be a good first step. But I have to say, in the United States, there has been a very meek and limited policy response to try to promote organic food and farming. And what it's going to take to overcome that is hard science and credible studies that document these nutritional quality and food safety differences, and the next level of studies are really the key, and that is showing in animal studies that the nutritional differences that are consistently present in organic versus conventional food, as well as the differences in pesticide residues, do in fact alter longer-term health trajectories. Now, nobody has the money, no government has been willing to fund a study over the lifetime of a human with, you know, the control group eating a standard conventional diet and the treatment group consuming predominantly organic food over a 60-year lifetime. It hasn't been done, and it certainly won't be done in our lifetimes. But with a mouse or a rat, it is entirely possible to do a study over the lifetime of the animal. And there have been a few such studies, and each of them has reported some tantalizing evidence of some improved indicators of health in the groups of animals that are fed the organic diet as opposed to the conventional diet. These studies are not cheap, but they are affordable. And it's my hope that in the next 10 years in the U.S., the government in its wisdom will actually support some of these studies. I'd like to be involved in some of them. I have an idea of some ways to move this science along, and I think there will be differences discovered. And the reason that I'm so confident of that is not very many people seriously question the notion that you know, a 20-year-old male that, you know, eats at fast food restaurants 4 or 5 times a week and likes potato chips and ice cream and eats some vegetables and you know, a lot of hamburgers but no fish, that individual is going to have a substantially different health trajectory than someone in the same age group that eats consistently eats a diet, conventional or organic, that more closely matches their needs. And you know, I think that the consequences of what people choose to eat on a daily basis, you know, how many dairy products, how many fruits and vegetables, and critically keeping total caloric intake balanced with their calorie needs, so that you don't gain 1 or 2 pounds a year, um, uh, that is clearly more important than whether the bananas are organic or conventional, or the carrots or the wheat or the dairy. But when you layer together responsible, good dietary choices plus organic, where you're essentially avoiding pesticide exposures through the diet and getting this nutrient bump that we see, particularly in antioxidants, that is going to positively affect across, in the U.S., a population of 320 million people. It's going to positively affect the trajectory of many long-term degenerative diseases that account for a huge share of morbidity and mortality in the U.S. population.
Thanks, Chuck. What a great explanation. The next question is kind of related to this, and the listener asks, can you speak further about the critiques to the study so that we as advocates can better explain and substantiate your work to the critics and get people, quote, to see the light, unquote?
Good question. I guess I'm proud to say there haven't been any credible critiques of our study yet. It's very rigorous. We had two of the top experts in the European Union on the statistics behind meta-analyses on our team. We did it as rigorously and carefully as possible. Now, where the criticisms that have come from Alan Dangor, the scientist from the UK that published the study in 2009 that concluded that there were no significant nutritional differences between organic and conventional food. He and other people, and in particular a number of the well-known proponents of biotechnology in the UK and across Europe, have criticized the study as overstating the public health benefits of these differences. And it's certainly true that some of the media coverage went beyond what the study did and reported, which are statistically significant differences in the levels of various nutrients. We do not say in the study that because of the average 17% higher level of total antioxidants in organic foods, we would project a X% increase in cases of cancer or diabetes or overweight. We don't make that claim. What we do in this study is we credibly and I think in an unbiased way quantify the differences in levels of a variety of nutrients that are known to be associated with the constituents and nutrients in food that promote good health outcomes, vitamin C, total antioxidants. Now, our study, nor any of the studies that have been designed to date, could not pick up a clinically significant impact on the incidence of any of the diseases and long-term health problems that are associated with fruit and vegetable consumption. The studies have not been done. They would be very expensive, and hence we are limited to understanding the differences in nutrient levels, which I think we've done and in a very credible way, and then pointing out that a vast body of epidemiological research concludes that people that ingest diets with higher levels of antioxidants have improved health outcomes. Now, no one can prove from any of those studies that Daniela Nuremberg is as energetic and pretty and healthy as she is because she bought her organic carrots and tomatoes and apples consistently over her adult life. Nobody can link how any of our individual health trajectories unfolds to just that factor. However, I think, and our team thinks, and I believe a growing number of scientists are uh, coming to accept that there is an opportunity across large populations to favorably impact the trajectory of health across the population. And switching to organic food, it's not a therapeutic treatment. It's not like, doc, I screwed up my knee, I need a new knee, or I've got a ear infection and I need to take some antibiotics to knock out the bugs, and then I'll be healthy. It's not the benefits from sound dietary choices and eating safe and nutritionally rich foods accrue over a lifetime, and most significantly to those individuals that are consistent in their dietary patterns. And I do believe in the next 10 to 20 years, science is going to prove that, but it hasn't been proven yet. So people like Alan Dangor and other people that feel, for whatever reason, threatened by organic farming will continue to point out that no study proves the connection between consuming organic food and any positive health outcome. Although there are few, there's a study that links predominantly organic meat and dairy intakes to reduced frequency of acne, eczema in children. That's been shown in 2 different studies. And there are a couple of other studies in humans that are suggestive of a positive health outcome, but we have a lot more science to do before we can stand up in front of a group of skeptical scientists and say, well, we got this covered now. We can prove that consistent consumption of organic food reduces the risk of type 2 diabetes or cancer or long-term neurological decline, etc.
Thank you, Chuck. We're running out of time, but my final sort of question to you is, how can the folks who have participated in this webinar encourage some of that funding and that investment that you think is necessary? Do you encourage them to write their local and national representatives and governments, or what are the best things that you think people can do to really push this agenda forward?
Well, I think the obvious answer is to be thoughtful about where you shop, and to the extent that you can and can afford, particularly organic fresh fruits and vegetables, because that's where most people are getting 90+% of their pesticide exposure and risk. I think it's very important for people to talk to the produce managers wherever they shop and say, I really want to be able to buy organic strawberries. I want to be able to buy organic spinach year-round because I've seen the residue data on spinach, conventional spinach, and I don't want to eat it. But spinach is a superfood. It's really good for you. So please, produce manager, stock organic spinach. And if you can't get fresh organic spinach for some parts of the year, please stock some of the excellent quality frozen organic spinach that can be gotten from a number of different suppliers in the U.S. and throughout Europe. I really urge people, in terms of their personal diets, and you don't have to spend the big bucks for imported fresh organic pears in the middle of winter, where you live. You can get canned pears, you can get dried pears, you can get frozen pears, and the organic companies in the U.S. are getting way better at picking fruit at the peak of ripeness when it tastes the best and it's full of nutrients, and freezing it in a way that retains as much of the flavor and feel of the fresh product. So, I'd way rather buy frozen blueberries or frozen strawberries from organic berries from Washington State than imported berries from Mexico in March. I just, it's a no, to me, that's a no-brainer.
Great suggestions, Dr. Benbrook. I want to take this opportunity to thank you for sharing your expertise with us. This has been incredibly informative. I also want to thank the many listeners that we had on today's webinar. We'll be sharing the link that Dr. Benbrook's presentation was on with both on our website and our Twitter account. And please keep in mind that this webinar was recorded and will be available later this week. Thank you again, Dr. Benbrook. It's been a great webinar, and we really appreciate your taking the time to speak to us.
Thank you, Danielle. My pleasure.